Okay. Great evening, everyone. I would like to know if you can hear me.
You're loud
All
and
right.
clear.
Yes, we can
Thank
hear you.
thank you.
We
We
can hear
can
you.
hear you.
Right. So we are so much happy to be here tonight. Personally, I'm very much happy because when you're happy when you see that your visions are actually coming to pass. So I'm happy that we have gathered again tonight on our second webinar. This is our second webinar for the month of February. We had the first one last month. That was on a feature-based drug design for biomedical and environmental sciences. And now in this month of February, we are looking at predictive modeling in biomedicine, pharmacognosy, and pollution control. So I really want to say thank you on behalf of Hendeb Industries Nigeria Limited. I am saying thank you for coming around tonight. I always have this habit of appreciating our participants because one thing is to receive an information, an advert that will be a training, and another thing is to keep to time, like to always remember that I have so training by this time. I know myself, many webinars, seminars, and training I have booked to participate, but one thing or the other will just take off my time, and before I could remember, if I check my calendar, I will see that that training was for yesterday, I missed it. So it takes that determination and courage, persistence to always take note of this time, and you made it to be you made it and you're available. So you can just clap for yourselves because you made this discussion to be possible. Assuming we came up and we didn't see anybody, it would have been somehow. But thank you for showing up. So we are going to move quickly to what we have today. We have a seasoned researcher here in our midst who will be anchoring this session. So I will go straight to the citation reading of our keynote speaker who will be in charge of this webinar. Now, like we have been saying since this month, that this webinar will be more of discussion. So please keep your pen and your book beside. Of course, Gemini is taking notes. So at the end, you shall get the notes of the discussion. So, and at the end also, you will receive the recording alongside with some PDF materials that you need for this topic that we'll discuss tonight. This has been our culture since this year, and we'll keep doing it. So here tonight we have our speaker, Dr. Owolabi Rotimi. I know that Doc is already waiting, so I will read the citation. Can you see my screen?
Yeah, we can.
Yes, we can.
Yes, we can see it.
So I will read the citation of Dr. Owolabi Rotimi while he takes over.
Yes,
Dr.
yes, sir.
Owolabi Rotimi. Okay, Dr. Owolabi Rotimi is a reader in the Department of Medical Pharmacology and Therapeutics, Obafemi Awolowo University, OAU, Ife, Nigeria. He is an accomplished academic and medical pharmacologist with extensive experience in teaching, research, and scholarly mentorship in pharmacology and therapeutic sciences. His affiliation with Obafemi Awolowo University, one of Nigeria's leading research institutions, reflects his long-standing contribution to academic excellence and biomedical education. Dr. Rotimi's research interests span key areas of medical pharmacology, toxicology, drug safety evaluation, and therapeutic mechanisms of action. His scholarly work focuses on understanding how drugs and bioactive compounds interact with biological systems, with emphasis on efficacy, safety, and toxicological outcomes. These research interests align with contemporary challenges in drug development, rational drug use, and translational pharmacology. He has authored and co-authored peer-reviewed scientific publications in reputable journals, contributing to the advancement of knowledge in, in pharmacological evaluation, toxicological assessment, and experimental therapeutics. His publications addresses critical topics such as drug-induced toxicity, molecular mechanism of drug action, and safety profiling of therapeutic agents, thereby supporting evidence-based pharmacological practice and public health decision making. In his role as a reader, Dr. Rotimi is deeply involved in undergraduate and postgraduate teaching, curriculum development, and student supervision. He has successfully mentored numerous students in pharmacology, medicine, and allied biomedical sciences, fostering strong foundations in research methodology, experimental design, and scientific communication. His academic mentorship continues to shape emerging scholars and healthcare professionals within and beyond his institution. Tonight, Dr. Olabirotimi will be also use his mentorship ability to mentor us and shape us in predictive modeling. So we are so much happy to have you with us, Dr. Olabirotimi. And at this point, I'm going to hand over the mic to Dr. Olabirotimi. Please join me and clap with your emoji as we just clap, keep clapping. Yeah, I'm not seeing few persons expressing their. If you have been with us for the past few trainings, you really know Dr. Rotimi Olabi. In fact, people have been asking me, give me his contact. So tonight we shall hear him talk to us, and it will be more like discussion, mainly interactive sessions, which every one of us is going to contribute our idea. Yes, keep clapping. Ladies and gentlemen, at this point, I would like to invite Dr. Rotimi Olabi for his presentation as I stop sharing my screen. Okay, sir. Sir, you have the floor.
Hello, everybody. Can you see my screen?
Yes, sir.
Yes, we can.
Yes, sir.
Am I audible?
Yes.
Yes,
Okay.
sir.
Thank you very much.
Doc.
Yeah.
Hello, Prof.
Dr. Henry, you wanted to say something?
If you
Yeah.
can, yeah, just help us and keep it at
I will do that.
presentation
I will
mode.
do. I will do that. I will do that straight away.
Oh, thank you so much.
Yeah.
All right.
Yeah. I want to say a very good evening to everybody. And I want to thank everybody present for taking your precious time out to join us in today's webinar. My gratitude also goes to the management of Hendep Industries for giving us this opportunity to use this platform to share knowledge among ourselves. The task before me today is to talk us through the world of predictive modeling. And I'll be talking about predictive modeling in biomedicine, pharmacognosy, pollution and control. Again, thank you, Dr. Henry, for that flattery citation. So you've helped me, to introduce myself. So we go straight into the business of the day. The task that has been given to me today is to inspire the interest of my audience in predictive modeling and how predictive modeling is used in biomedical, chemical, and environmental sciences. So the objectives of today's lecture is to x-ray the application of predictive modeling in biomedical and environmental sciences, with emphasis on the application of QSAR, QSPR techniques in phytomedicine. I will also be talking about the various tools that we can use to assemble, validate, and evaluate predictive models. And we also look at the strengths and the limitation of predictive modeling as a research tool. By the end of the lecture, I hope that we will have been able to discuss what descriptor calculation is, the protocols for descriptor selection. We also look at the types of predictive models that are available. We look at the various tools that we can use to validate and interpret a predictive model, and how we can use predictive models to screen as a screening tool for data sets. Before we dive into the depth of predictive modeling, let us start from the basics. Let's define our terms. Predictive modeling, it's from two words, predictive and modeling. Predictive is quite straightforward, but let's look at model. Model is a word that we use in our everyday activity, a role model, a model partner, a model house, a model car, model husband. And in this context, we use model to depict like a prototype, an ideal, a reference point, sort of. And the meaning of modeling, predictive modeling, is also not perfect from this. But again, there is some sort of modification. And what is in this? Wikipedia actually defined a model as an informative representation of an object, person, or system. A more scientific definition of a model is that it's a conceptual construct of an object or a process or a system. And for a model, one of the peculiarities is that it has some features, and it is as these features that stand it out, as a reference point or an ideal object or a process of a system that we want to always attain. And because of these features of the model, scientifically we can represent them as data. And when we convert these features of the model into data, then we can build it into a formula or an algorithm that we can now use to screen out, variants that we have that we want to use as solutions to our problems. To bring it more home, let us look at the scenario of a young lady that is trying to get a husband for herself. The young lady has decided to get married, and she's having in her mind, what her husband is going to be like, what kind of dream husband, is in her mind. This husband definitely has to have some features or characteristics. Of course, he has to be rich. He has to have some physical features. He has to have, a dream background, maybe family background or religious background. So all of these peculiarities or characteristics of the would-be husband are the features of the husband, and these features has to be built into our mind so that when suitor starts coming to ask for a hand in marriage, she will be applying these features to screen the would-be suitors to eventually choose which of them, best suits the model that she has in mind. So the same analogy or the same paradigm is what predictive modeling also does. In predictive modeling, we use the features, of an ideal model. And here, our ideal model is the solution to our problem. When we have a problem to solve, we have, a solution in view. And that solution has some features, that makes it fit into solving that problem. And it's actually these features that we fit into an algorithm. And when we have that algorithm with those inbuilt features, we can use that algorithm to screen millions, of candidates, of candidate solutions. And among all of these candidates, we choose the best suited to solve our problem. So predictive modeling, involves the use of mathematical, statistical, and machine learning algorithms to predict the features of a model, using existing data. It means that the existing data that we use that are available is what we are going to use to predict the future. And predicting the future means creating an ideal solution that is going to solve our problem. Predictive modeling is somewhat, is likened to what we call the crystal ball. Some people have likened it to the crystal ball. And what is the crystal ball? It's called the crystal ball of data. A crystal ball is actually a clear, colorless, glass sphere that is used by mystics or fortune tellers to gain insight into the future. They look at the reflective surface of the glass and they tell you what is going to happen in the future. So in the same way, predictive modeling takes a look at data, looks at the pattern, among the features of variants that are available for as candidate solution. And when they are able to get a pattern, that best fits a solution to be, a problem to be solved, then it is that candidate is taken or qualifies to be the solution to the problem we're trying to solve. So in the biomedical and environmental sciences context, predictive modeling is a systematic reproducible pipeline that converts input features into reliable desired outcomes for biomedical and environmental applications. So I'm going to use two examples here, again, to further explain what the concept of predictive modeling is. The first example is, let's assume that we want to develop a drug. We have, libraries of compounds where we want to get our drug from. We want to screen this library of compounds, for the most suitable among them, for the one that will most qualify to be a drug. So what we'll do is that among all of these drugs, we look at their features. And these features, is when we are talking about drug discovery or chemical compounds, we are talking about molecular features. So we can talk about molecular descriptors or molecular features or protein features. We feed in these features into a special algorithm that discovers the pattern that we need as a drug. And when we develop that model, we can now use that model to screen all the compounds that are in our library to bring out which of them best suits to become a drug candidate. And what we'll be looking for here in terms of output, we feed in the molecular descriptors. What is the output that are going to be looking at? We're going to be looking at biological activity, binding affinity to a receptor, to an enzyme, and etc. The second example is for environmental studies. For example, we want to look at, our endpoint bioaccumulation index, toxicity level, ecological risk index of a particular ecosystem. It may be water, it may be soil, it may be air. So what we do is that we collect samples, of these ecosystems, and we look at features of this ecosystem as well. It could be metal concentration, the pH, organic matter, temperature, and other features. And again, we build a model that will screen, these ecosystems for these endpoints in terms of whether we are interested in the toxicity level or the ecological risk or and other, environmental indices. So in this talk, I will be focusing mainly, on biomedicine, and talking about biomedicine. I'll be focusing mainly on my area of comfort, which is drug discovery. Apologies for those that are in other field of studies. But again, the good thing is that all of us are going to have something to take home today, because predictive modeling is actually a mechanistic, is a tool that is strongly mechanistic. And once we are able to x-ray and understand the mechanisms involved in predictive modeling, we can use it to solve complex problems beyond biomedicine, pharmacognosy, and environmental sciences that we are talking about today. Predictive modeling can be applied in any of our endeavors where solutions to complex problems, are a necessity. So again, coming back to the core framework of predictive modeling in phytomedicine, let's imagine again that we want to develop drugs from phytochemicals. Phytochemicals are chemicals that are derived from our plants, and these phytochemicals have biological activity. I want to explore their biological activity in the treatment of diseases. So to do this, we have nature has given us a plethora of natural resources in terms of plants biodiversity. So it means that we are going to have thousands or millions of compounds that we want to screen. We cannot take these compounds to the lab, one by one. So it's going to be a lot of laborious work, and it's going to be quite expensive, which is actually some of the strengths of predictive modeling as a research tool. So what we'll do is that we'll look at the features of these compounds. When we are talking about features of chemical compounds, we're talking about mainly the structure, and we can use the features of these phytochemicals, process them as data and put them in a model, and use that model again to screen the millions or thousands of compounds that are potential candidates for our drug discovery. And these algorithms can stem from simple mathematical equation depending on the complexity of the model, to statistical modeling, and recently machine learning and deep learning tools have also been developed. We'll talk more about all of these tools as we dive deeper into the topic. So one of the features that is commonly used in drug discovery is these features that are commonly used in drug discovery are their molecular features. And these molecular features, has led to the development of two major concepts in drug discovery: the QSAR, called the quantitative structure activity relationship, and the QSPR, that is the quantitative structure property relationship. The concept of QSAR actually is based on the fact that the molecular structure correlates with biological activity. What does that mean? The biological activity of a compound correlates or is determined by the structure or the structural properties of that compound. And this is based on the similarity principle, which means that compounds with similar structure will have similar biological activity. And this concept is widely used in drug discovery, from ligand-based drug design to lead optimization, and so on and so forth. And the endpoints, of course, have to be activity related, and this includes effective dose 50, toxic dose 50, inhibitory constants, lethal dose 50, to mention a few. The next concept, or the second concept that is also popularly used in drug development, is the QSPR, that is the quantitative structure property relationship. Similar to the QSAR, we are also talking about structure-based property, but structure-based property. And it means that similar or drugs or compounds with similar structure will also have similar physicochemical properties. And again, this is widely used, in drug discovery, especially in investigations like drug likeness, the ADMET screening, pharmaceutical drug disposition classification system, that is the BDDSCS, lead optimization, to mention a few. And the endpoints we include, how soluble our drug is going to be, the drug likeness parameters, like LOP, blood-brain barrier permeability, bioaccumulation, and so on and so forth. So what does the predictive modeling, what are the stages involved? What is the workflow like? If I want to set out to use predictive modeling as a tool, how do I go about it? So the processes or the stages that are involved in predictive modeling are as follows. When you want to embark on predictive modeling, the first thing thing to determine is your endpoint. What do you want to achieve? What is your endpoint? What solution are you trying to arrive at? After defining our endpoint or the solution, then we go ahead and do our data collection. We collect our data, we process our data, we clean our data, and from our data we can go ahead and generate what we call molecular descriptors. Again, as it relates to phytochemicals. And this molecular descriptor calculation is done by tools that are, specifically designed to do this molecular, to derive these molecular descriptors. And molecular descriptors, are going to be talking about them in details, are just numerical formats of the features that we collect from our data. Then after calculating our molecular descriptor, we do what we call descriptor selection. And after the descriptor selection, we input the selected descriptors into our model to build our model. After building our model, we train our model, we validate it. And once we are sure, once our model passes some of the evaluation metrics, then we can go ahead and deploy our model to screen our candidates. So let's dive deeper into each of the stages involved in predictive modeling workflow. As I said, the first thing to do is to define the endpoint. The goal is to define clearly what the model wants to predict. We need to, again, define our endpoints specifically. For example, are we talking about, drug activity in terms of IC50, LD50 solubility, or you are talking about properties, like toxicity, or whether it can be active at a certain target or inactive. And the best practices associated with this is that the fact that you have to use experimentally measured endpoints. That is, your endpoints must be measurable. And again, you have to avoid mixing assays in terms of, is your endpoint going to be a continuous one or is going to be a categorical one? Let's take solubility, for example. Solubility can be continuous when you are talking about expressing it in a numerical value. And solubility can also be categorical when you just want to know, is it soluble or not? And when you want to know about the degree of the solubility, you may have to extend in a continuous value. But if you just want to categorize whether it is soluble or it is soluble, and you have, identify your measures of solubility, again, you can decide to use it as a categorical. So what I'm trying to say here is that you have to be clear in your head, what type of endpoint you are trying to make to define. Is it continuous or categorical? The next stage is the data collection and the data set. So you've defined your endpoint, then you go to town and look for those features that you are going to use to input in your model. And these features for drug development, there are many sources where you can get all these features. from bioactivity databases like phytochemical database, IMPACT, Dr. Dukes, and so on and so forth, ChemBL, PubChem, Drug Bank, all of these, databases are very rich in these features, and you can generate these features from there. You can also go into, various environmental toxicity databases for those of us that are into environmental sciences, or you can even explore literature like academia.com, Google Scholar, PubMed, and so on and so forth. But at this stage, this is where you begin to lay the foundation of the success or failure of the model that you are trying to build, because your model depends highly, or the success of your model or the effectiveness of your model depends highly on the quality of the data that you are able to collect at this stage. So you have to be sure, of the source of your data and make sure that your data is credible. The third stage after the data collection is the estimation of the molecular calculation, the molecular descriptor calculation. As I said earlier, descriptors, are numerical values of our features, and descriptor calculation is the process of converting the raw information derived from the features into numerical variables. And it is these numerical variables that will ultimately be used in building our model. So the goal for molecular descriptor calculation is to convert available information of the features into numerical descriptors using appropriate tools. There are many tools of numerical calculators that we can use. Some of them are, open source. They are free on the internet. One of them that is very popular is called Padded Descriptor. We also have Dragon, RDKey, to mention a few. And these descriptor calculators can actually help us to convert our features into numerical variables. And the output of this calculation is actually run into hundreds of thousands of descriptors for each molecule. So again, to further throw more light on on molecular descriptors, as I said, molecular descriptors are numerical representation of chemical features that can encode information, about molecular weights, SMILE scores. For those of us that are into chemoinformatics, we know that all of these properties can be derived from the molecular structure of our compound. So again, with emphasis on drug discovery, when we are discovering our drug, we can generate these features about our compounds, and from these features, we can get our molecular descriptors. So again, the type of features that we generate from our compound can also be divided into categories. And what are the categories of these molecular descriptors? We have constitutional descriptors, and these are, descriptors that are derived, from the molecular formula of a compound. This includes molecular weights, atom counts, number of rings, functional groups. The next stage in the ladder are topological descriptors. This has to do with, the kind of connections between the atoms in the molecules. They're talking about the bonds, what nature of bond, is it covalent, is it hydrogen, what kind of branching, is involved. And this can be derived from the 2D structure of our molecule. The next stage is the geometric, talking about bond length, the spatial orientation, the molecular conformation, and all of this can be derived from the 3D structure. We also have electronic descriptors that is talking about dipole moment and partial charges, and physicochemical descriptors of our compound, talking about log P, solubility, polar surface area, TPSA, and so on and so forth. So the to give a more concrete, example of the workflow, let us imagine again that we want to develop a drug from phytochemicals. So what do? The first stage, we have to prepare the molecule. In doing the preparation, we obtain a clean molecular structure by removing the salts, we remove the solvents. These are all in silico procedures. We obtain our molecule from the database, we clean it up, and from there we generate our features. And these features include SMILES, as I said earlier, the structural data file, the MOL file, and the common tools that can be used to achieve this include ChemDraw, PubChem, OpenBabel. When we generate these features, we input these features into our descriptor calculators. Again, the tools that I've talked about earlier, Paddle, IDKit, Dragon, and so on and so forth. So when we input these descriptors, these features into the descriptor calculators, they generate the descriptors for us in the numerical form. So once it's generated, we can download the results in the form of a matrix table. And this is a prototype of the matrix table. This is just the tip of the iceberg, of what the matrix table looks like. But again, here, what I want you to look at is those descriptors, on the first row, and on the rows underneath, you can see their numerical values, the features and the descriptors, and of course the compound down in the first column. So the output of a descriptor calculation can be up to 3,000 descriptors, and because of the large number of descriptors that are generated, and the fact that many of them can be redundant, noisy, and irrelevant to the building of our model. In fact, some of them may even, contribute to the model not working ideally. That is, they can contribute to the poor quality of the model. And because due to this, we need to select only the relevant descriptors for us to build our model. And that is why you have to do what we call descriptor selection. And descriptor selection is the process of identifying the relevant and the most informative variables from a large pool of the calculated descriptors. And if we go ahead and use an unfiltered descriptor, our models may suffer from overfitting, poor external predictivity, low interpretability, and instability across data sets. Let me bring the scenario of the lady that I used at my intro, that is trying to get herself a husband. If, for example, the number of features that she has in her mind is so much that none of the suitors will be able to meet, the criteria, she may end up not getting herself a husband at all, right? So again, the same thing, works for predictive modeling. If your criteria are too much, then the validity or the ability of your model to screen will also be affected. So fewer meaningful descriptors will outperform many irrelevant ones. Let's again look at this. You look at another, more scientific example. Again, we are trying to develop about some plans for anti-cancer activity, and in our plans we have generated about 1,500 descriptor, for plant alkaloids. Definitely, this is too much. We need to cut it down. We need to prune it down to the relevant descriptors. And because of that, we have to remove the redundant descriptors and choose only those receptors, or only those descriptors that are relevant to our desired endpoint, which is the anti-cancer activity. So what are the benefits of descriptor selection? It removes redundancy, improves predictive performance, enhances biological and chemical interpretability, and also increases the robustness of our model. So there are also various methods that we can use for our descriptor selection. And these tools or methods for descriptor selection, varies from the very simple ones that you can use, for your simple models, to the very complex ones that you can deploy to select descriptors for complex models. So what are they? The first one is to remove the descriptors that have low variance. What does this mean? For the descriptors that, that are very close to each other or that are having the same value, right? If you have a number of descriptors that have almost the same value or the same value, what that is telling you is that those descriptors are probably representing the same feature. And because of that, you don't they are only going to contribute to redundancy. So what you need to do, is to remove, is to find one that will be able to represent all others that are having the same numerical value. Again, our lady that is looking for a husband, she wants to determine how wealthy her husband is, and she's putting features like how many houses has he built, how much is in his bank account, how many cars does he have, how many companies does he have. I mean, all of these are assessing the level of wealth, and inputting all of those features, into the criteria will only compound the issues. Number two is that when you are generating your descriptors, your descriptors, you can have some missing values. And when you have missing values, what do? You have two options here. One option is that those missing values can be replaced with the mean or the median of the other values that have been generated. But again, beware. The more descriptor you add, the less the quality of the model. The next method that you can use for your predictor selection is to conduct what we call univariate statistical filtering. And what does this mean? You can look at the correlation between your descriptors and your endpoint. If your descriptors correlate very well with your endpoint, then again, it means that they are very relevant. So you can set, cutoff values for yourself, conduct your correlation between your descriptors and your endpoints. And if you can select only those descriptors that pass your set cutoff point. You can also do what we call correlation filtering, and this is doing correlation among the descriptors themselves. And if you find descriptors that highly correlate to each other, again, it is very likely that they are doing the same thing, in the model. And again, that will also contribute to redundancy. So among those that are correlating with each other, find the one that correlates best with the endpoint and use that one to replace the others. There are also more complex tools that you can also use to do your descriptor selection. You have machine learning tools, and you can also use deep learning as well. Most of them are represented in the slide. I will not go deeply into that. Maybe at the end of the lecture, I will share my slides with those that are interested, and we can look at this machine learning and deep learning tools for descriptor selection. After you must have selected our relevant descriptors, the next stage in predictive modeling is the actual model building itself. So the model building or model development is the process of learning and applying the mathematical algorithmic relationship between selected descriptors and our desired endpoint using data for training. And there are also many tools that we can use, to develop our models. We can develop our model using simple mathematical equation that is based on the natural laws of interactions among the features. For more complex models, we can use statistical or machine learning tools, that can also capture the statistical relationship between these descriptors. The machine learning tools use simulation. They are simulation based, and they use complex computer algorithms. The deep learning tools use neural network, algorithms to build our model. Again, what all of these tools do is that they develop algorithms that can predict outcomes based on established patterns and relationships that is found in our selected descriptors. So again, this is a summary of all the tools. I've classified them, according to their where they belong, whether they are statistical tools or machine learning tools or deep learning tools. So again, for those of us that are interested in that, we can look into that, later. Again, during the building of our models, again, we have to determine what kind of model we are building. There are basically two major types of models, or predictive models. They are the classification models, and these are models that are used to predict category or class of an observation based on input feature. So the output, is what we call binary. It's either yes or no, healthy versus disease patients, a gene expression in one disease or is not expressed in another disease. And the tools that are used, for the building of this type of models include logistic regression, KNN, K-nearest neighbor is an unsupervised machine learning tools. We can also use neural networks for deep learning, again, for this type of model. We can also have what we call the regression models, and these are models that predict numerical values. They are useful to estimate factors like disease progression, drug dosage, patient survival rates, and the tools that are used for the building of this type of models are linear regression, random forest regressor, partial least square, XGBoost. These are machine learning tools, and we can look at them in details later. So once we have built our model, the next thing is that we want to test our model. How valid is our model, and evaluate its performance. This can be done, using what we call internal validation. We can use cross-validation or bootstrapping approach. Or we can also use, and this involves the use of part of the data that we use to build the model. After it has passed internal validation, then we go for external validation, using subjecting our models to examination of data sets that were not employed during the model construction. Now, after training our model and testing, then of course we have to look at how our model is performing, and we have performance metrics to evaluate the performance of our model. And the performance metrics include coefficient of variation, or R-square, and this measures how well our model predict an outcome from a scale of 0 to 1. The more the better. 0.6 is considered to be okay. Adjusted R-square is also a modified version of R-square, but the advantage of adjusted R-square is that it makes adjustment for the number of predictors. That is, it can tell us, by the time we are increasing our predictors to a certain number, it can tell us whether we're already having law of diminishing return. So it tells us the ideal number of predictors that is good for our model. For root mean square, or RMSE, it shows how far the predictions are from the actual values. Lower values suggest more accurate predictions. We also have mean absolute error. It's the measure of average absolute difference between predicted values and the actual value. We also have Q-square, which measures the model's predictive relevance. So again, let's use all what we have discussed to try and solve a phytochemical problem. We want to predict the ability of a phytochemical to chelate heavy metals in polluted water. What do we do? Number one, we define our endpoint, right? And our endpoint is that you are looking for a chelating agent, right? We know the metal, of course, that we want to chelate. We go ahead and obtain our phytochemical features of these chemical compounds based on their structures. From their features, we generate the descriptors. Once we generate the descriptors, we develop the QSPR model. That is the model that are relevant to the metal binding activity. Once we develop our model, we test and validate it. And once it's valid, then we can use it to screen our library of compounds for chelating properties. I'm bringing this up because, again, I know there are a lot of us that are interested in phytochemicals or herbal preparations for the treatment of metal toxicity, right? And the majority of the studies I've seen are focused on antioxidants. Maybe this is another method, or tool that we can use that can extend our focus beyond, oxidative mechanism in heavy metal toxicity. So this is not just in polluted water. This can also be done even in the body to develop effective chelating agents from natural products. What are the applications of predictive medicine, predictive modeling in biomedicine? As I said, I've talked a lot about drug discovery. Sorry, somebody's what's so-called speaker is not muted, and it's actually affecting me here. So you could do well if you help me to mute your speaker. Thank you. So what are the applications of predictive modeling in biomedicine? I've talked a lot on drug discovery, especially from, whether it's from natural or synthetic origin, using it for drug development, ADMET, properties, for personalized medicine, clinical imaging. In fact, there are some predictive models now that are used for reading, clinical image that has been said to, compete in terms of accuracy, even with well-trained, specialists in imaging. We can use this for disease prognosis. We can use this for, drug-gene interaction studies, medical diagnosis, disease risk assessment. The list is endless. In environmental studies, we can use it for prediction of pollutant toxicity, heavy metal contamination, air quality prediction, biodegradation modeling, ecotoxicological risk assessment. What are the strengths of or advantages of predictive modeling? Of course, the cost effectiveness. It gives us the opportunity to bypass, the laboratory with the wet lab, especially in the early stages, of our problem solving. It's fast and it's automated. So, and that is why it can screen, a lot of compounds. So it has this high throughput screening ability. Of course, as I said, it reduces reliance on the dependence on animals for testing in the biological research. And of course, because it's in silico, it also removes, human bias and human error. So it reduces, subjectivity in decision taking. Despite all these glowing attributes, predictive modeling also has its own challenges and limitations. And what are they? As I said earlier, data quality. The better your data, the more valid your model. Prediction selection, I've highlighted this, the challenges in prediction selection. You have to use robust tools to choose relevant predictors that will contribute to the value of your model. Very high, complex models requires the use of machine learning and deep learning. And some of the algorithms that are used, they are the so-called black box models, can be challenging to interpret. We also have issues with validation. So your validation should also, also requires a lot of computational input. Predictive modeling is a multidisciplinary enterprise, and it has a very strong computational input, especially when we are talking about complex models. So again, availability of expertise is also an issue. For clinical studies, clinical studies that require clinical data, data privacy is becoming a big issue. This is not we can no longer bank into anybody's data and be using it anyhow, so that we don't run into trouble. So that's another issue. Another big drawback in almost all in silico tools is the fact that they are often oblivious of biological diversity, especially when we are talking about biomedical use. So again, this is another major drawback. So in summary, a predictive modeling integrates mathematics, statistics, and machine learning. It supports drug discovery and phytomedicine, enhances pollution control and environmental risk prediction, requires careful descriptor selection, and must be validated properly. In conclusion, predictive modeling is a versatile tool that is relevant in finding solutions to complex problems across board. It performs large-scale screening of features to predict desired model solutions in a fast, cost-effective, and efficient manner, and it employs algorithms ranging from simple mathematical calculations to complex learning tools. These are my references, and I want again to appreciate you for finding time to listen to my presentation. Thank you very much.
Wow, that was a wonderful presentation. Please, Can we respond by clapping for Doc? Just keep clapping with your emoji. I don't know, but I've really learned a lot. So we are going to go to Q&A, questions and answers, which I want us to discuss. The presenter has really dealt on predictive modeling, and while he was talking, too many things just entered my mind. Yeah, too many things entered my mind, which how which we can form a formidable research group. Yes, how which we can have that out of all these trainings. A research group that can fly both local and international. A research group that will have big men, people that have money, and people that have knowledge, who can pull in their resources. Because I just looked at this predictive modeling, and do you know that those of us who are in med lab, in the laboratory area, do you know that our biomarkers, our laboratory kits is actually operating based on predictive modeling? It just crossed my mind. Your biomarker senses an algorithm that has been built in that manner. It operates, it senses something that has been stored in it. So when you like combine, those who have done analysis test, your combine, they are just like predictive models. Your pH meters, they are just like predictive models. So it has vast applications. You can apply it in building machines. Yes, you can apply it in building machines. They are just like predictive model because system has been modeled, controlled with data. And when you see such features, then because the modeling must not be only on data, it can model with features. So when you see these features, give this output. When you see this kind of features, read this thing. This will be your output. So I really want to appreciate Dr. Olabi once again for that wonderful presentations. I would like to take your questions, so you can do it to keep your hands up as we do that spontaneously. All right, we have Osman Abdullahi. Please go ahead, sir. You have the floor. Osman, can you hear me, Osman? Hello, can you hear me? Abdullahi Osman. Okay. Can anyone else hear me?
I can hear you.
We can hear you, sir. I can hear you, sir.
Okay. Okay. Maybe Osman is
Call him again. It's Usman.
Usman. Okay, Usman. Usman Abdullahi. Okay, please, who else? Okay, let me invite Dr. Vincent. Sir, you can go ahead, sir.
All right. Very, very well presented. My question really is that after you have developed the model, okay, how can you ensure that the model can be used in real world situation, apart from developing it in using your tools and statistical methods? How can you really be very sure, or how can you ensure that this model can work in real world scenario? That would be my question, please.
Okay, that is a wonderful one. We invite our speaker, and then the questions will just be open. So after our speaker must have done his contribution, then every other person put your ideas and let's discuss how can we turn this model from computer to a real life application. Thank you very much.
Yeah, thank you very much for that question. One thing about model, which maybe I didn't elaborate more on, is the fact that models are domain specific. As I said, by the time you are starting your model, you have to define your endpoint. And because of that, models are developed towards solving specific problems. They are domain specific. If I understand your question very well, how the limitation of model is the fact that they can only solve problems for which they are developed. In terms of real world scenario, well, it's an in silico tool, and again, the limitations I've highlighted them. But again, we can continue to improve the performance of models based on their domain and the kind of solution that we want them to, or the kind of problem that you want them to perform. So take, for example, a model that was developed for the development of anti-cancer. Again, for a particular type of cancer. As we know, a cancer is a moving target. It becomes, knowledge is, you get more knowledge on cancer biology almost every day, which means the features will be increasing, the features may also be changing, and we can actually modify our model again by modifying these descriptors or using more accurate and deeper algorithms, that will be able to modify the efficiency of our model, so to speak, depending on the challenges that we have. Using it for real world scenario, if I also understand you, in terms of application to solve problems without further requiring validation, if that is what you mean. Well, I don't know, again, because of the inherent limitation being an in silico tool. And one of these, limitations that is also going to limit its use as an independent or a final, arbitrary in solving problems is the fact that it's not able to incorporate, especially for clinical medicine, is not able to incorporate biological diversity. Yes, I know we are going towards personalized medicine now. Maybe, again, if we are able to also incorporate the recent developments in personalized medicine into predictive modeling, maybe that can also help, in targeting, peculiar patients with peculiar problems, and we develop a component of that model that will make it robust enough to be able to deliver targeted solutions to targeted patients. I don't know if I'm making sense. So that's the way I see it. That's my opinion. I don't know if I've answered your question, sir.
Okay.
Well,
Thank
you very much. Okay, fine. That's all right. Can go ahead,
okay,
please.
Let me just also add to what Dr. Rotimi has said. Our major concern, I really liked the point. Our major concern is the real life application, and that goes to my slogan product. Can I make this my model productive? Now, let's look at our weather forecast. The weather forecast they do. If you look at your TV stations, you hear about there will be rain in Lagos, there will be sunshine in Abuja. These are predictions but these predictions were actually made by real life data. So if you want to have this model be used for real life, first of all, build that model with because all models are not built by computer generated data. Once you have built a model with real life data, that is why the challenge is availability of data. When we are building our database last week, we are using experimental data. So let's say I want to build a model that will track, that will detect early cancer in patients, that will detect early cancer in a given patient. So I'll begin to use that person's medical history that are related to cancer. That person's medical history. So this person has been coming often. Now, I will now build a model that if this case, probably this person always come and report chest pain, this pain, I will use all those things to build a model that will not predict if this certain illness continues, if this signs continues, in the next 10 years, there will be cancer. That patient will begin to develop cancer. So you see that I have turned that model, that patient's medical history, medical data, into a model that cannot predict that in 5 years' time you have cancer. And again, for those coming from the pollution control, we can sample heavy metal concentration in a particular river. We took top, bottom, and different depths. We can now use those heavy metal concentration. Probably we took for 5 years. We keep collecting this data. We can build a model that will say, if this concentration gets to this level, that model will now predict the adverse effects. So we now begin to reduce our anthropological activities that will lead to a concentration of that heavy metal. So once you build a model with real life data, then the application will also be to real life, because it will not predict future occurrence, what will happen if this data gets to this extent. Thank you very much, Doc.
Yeah, so I think you throw some really good light into my question, really. So the problem here, really, in this predictive modeling is actually getting real life data to which we can now build models using the real life data, and then before we can deploy them and possibly also escalate to other scenarios that may be very close or that are aligned with the model we have built over the years. So thank you very much. I appreciate your response, and also I appreciate Dr. Rotimi for the insights. Thank you very much.
So our problem is just availability of data, and that was why when I started chemoinformatics last week, I lamented on that we should go back to our departmental levels and begin to store our data. That is, if we are sure of the laboratory result the student gave to us in those research work, we should begin to store our data. Okay, I would like to take John Elijah then before Professor Adiola. All right, Dr. John Elijah, you have a question? Contribution.
Thank you so much, sir. Let me thank Dr. Rotimi for the exhaustive teaching and explanation. I really appreciate that. My question is just, I want to find out the minimum data that is required to build a predictive model.
Okay, I think I will not stress Rotimi to come up to that. It's just a minor question. Minimum data, this data you are using, you intend using it to train a model. You are training this model to work like a human brain, mostly if you're using machine learning. You need as much as you can, not less than. If you can get 1,000 data on that, data must be specific on what you are building the model for. So if you can get 1,000 data, is not too much. 1,000 data is not too much. It's really not too much. If you have 1,000 data, it's okay to start to build a model, because that model must be trained to avoid mistake. Because if it's not well trained, if the model is not well trained, then the result it will give, the precision of that result will be very poor, because you just trained, you just use a few hundred data to train. We're having a training next week. The advert should be out this night or latest tomorrow morning. It's a free workshop next week on QSAR and QSPR, which we have been talking about every time. So you need up to 1,000 data to build model. But the problem is the availability of this data. Thank you.
Thank you, sir.
I can see Professor Adiola hand is up.
Okay, can I speak now? Thank you.
Yes,
I would like to first of all thank the speaker, Dr. Rotimi, for a very good presentation. He actually broke down a lot of things so that we can all understand very well. And as Dr. Vincent was asking his question, honestly, it was as if he read my mind. I was also thinking about it, real life scenarios. And his question kinds of it kind of merges with Dr. Henry's vision of drugs and products. So I was just rolling it over in my mind. I was questioning myself. Okay, we have this knowledge of models, even models that are obtained with real life data. But in real life scenarios, what do we do with what we have? For example, let's even say we eventually get our drug and products. There's this. I was looking at it from one point. There are several points. Dr. Harry, you still explain the cancer scenario that you mentioned. You still explain. But as I was thinking about insecticide resistance. So we end up getting these insecticides because we have models, and the model eventually works. But like the speaker said, in real life scenarios, these are moving targets. The insect itself is fighting your drug. You've already predicted that this model will work. There is the target site is obtained, and at the beginning it works, but the insect itself, the target site can become insensitive to this model that you have tediously, with all your energy, time, produced. The target site can suddenly become insensitive. Another thing is that some of these animals, they, like insects, they also have detoxification enzymes, so that even with the models, by the time you get to the real life scenarios, despite the fact that the models are good, you are still having issues. So my question is this going to be a forever problem, continuously checking models, using models? I know that for insecticides, in solving this problem, sometimes you can mix the models. Let's say you know that this model is working and then it's no longer working. Or maybe you even tested it. You want to do real you want to do real life work and you find that the model is not working, I'm even thinking that we can begin to combine models, like combine insecticides, so that if an enzyme, if there's a detoxification enzyme in the animal that is detoxifying your model that has bound before, you can still come in with a second and a third one and put them together in the drug, so that if it's escaping one, it's not going to escape the other one. I don't know whether I'm making sense, please.
Well, maybe I will take that up. And I think that is also an extension of Dr. Imije's question. Dr.
Is that
Henry has
Dr.
provided.
Vincent?
No, this is Dr. Owolabi.
No, you said Dr. Emeje.
Yeah,
You say
Dr.
it's an
Vincent.
extension
Yeah,
of.
yeah, yeah,
Is Dr.
yeah.
Emeje Dr. Vincent?
Yeah, he is.
Okay,
Yes.
okay. Yes,
Yeah.
it's an extension.
Yeah,
Yes.
yeah. These questions are very germane, and they are real scenario. They are real world questions. And as I said, I mean, it's not just a cancer. Most of our problems will evolve. We keep on evolving to our solutions. I mean, we provide solution, new problems comes up. And I think that is the essence of humanity. We are here to continue, to provide solutions to problems. But then again, as it concerns predictive modeling, an aspect of it is what Dr. Henry has said, availability of data. But beyond data, there is also the algorithm, that is also continuing, that we also process this data and build a model. And as I said, your model is as good as your algorithm and your data. So what determines the strength of a model is not just the data, but the algorithm. As we can see from my presentation, these algorithms range from simple mathematical equation to complex deep learning. And when we are talking about deep learning, we are talking about algorithms that work like human brains. So if all these concerns that you are raising are also part of the features that can be used to build the model, the concerns you are raising today are those concerns that are known to us. Even after we must have addressed this concern, believe you or me, believe, I mean, I can assure you that even after taking care of these concerns that you're raising today, new problems will evolve tomorrow, in response to the solutions that we have provided. So as I said earlier, models can continue to be renewed, they can continue to be enhanced in terms of capacity, talking about, the algorithms, the robustness of the algorithms, the depth of the algorithm, how they are going to be taking care of all of this. And again, these are computational problems. And of course, the data angle that Dr. Henry talked about. So in summary, data and of course, computational algorithm to be able to take care of this problem. Again, when we are building a model, we are not even sure what nature has in place for us. And I talked about biological variability. That is also a problem. What you are built, let's say for somebody that you have studied for over a number of for a period, for a number of years, in terms of the patients that Dr. Harry, made mention about. Yes, apart from, the data that we are collecting from him, what is going to happen later? We can only know data based on what has happened in the past to predict the future. But when they enter these futures, are there going to be new features that that person is going to acquire that will even, again, make our model, challenge our model, that we may have to even increase the robustness and the capacity of that model to continue to provide, predictive, to continue to predict the future of that patient or any other problem that we are talking about. Again, data, availability of data, of course, and the robustness of the algorithms that we are using to build the model. Thank you.
Okay, that is a wonderful one. I will just, I know Professor Diola still have more to say, but before then, let me add my own little contribution. I love that problem she really cited. Insecticide, over time, our model was able to it was useful on this insect, but now after some period of time, the model failed. And then can we combine other models? Now, once I've done the work, I've done work on insecticide. Yes. Now, just like we are now having issues of antimicrobial resistance, it was not there. So those models that was built when there was no issue of antimicrobial resistance, we failed. Now, the model that was built when the issue of multi-drug resistance, when that issue was not there, those models will fail now. So over time, there is evolution. There is genetic mutation. So if you want to build that model now, that model, it will take long time, because you need data on genetic mutation. You need data on enzyme overexpression. These are factors that will contribute to your insect resisting insecticides. You need data on structural barriers. You need data on behavioral adaptations, because this insect can adapt. You need data on genetic variations of this insect. So if you build models on each of these, then combine them together, you're going to definitely solve that problem. It's a robust research. You solve that problem of insecticidal resistance from this insect. We definitely solve that problem. Thank you very much. Yes, you can contribute. It's really, we are here to discuss modeling.
We still have hands on though.
Yes. Okay, let me take Daniel, Dr. Daniel, then before Dr. Sani. That's it. Dr. Daniel. Yeah.
Thank you very much, Professor Rotimi. That was very insightful, and really appreciate you. We celebrate you, sir. There is actually a language, will I call it language or terms? Each time I hear of deep machine learning, each time I hear of predictive modeling, I will always hear people talk about R programming, Python, and all those things. So, but I didn't hear us talk about these dimensions. So where do we bring these dimensions into our discourse? That's my question.
Oh yeah.
Okay.
Thank you very much, sir. Yeah. In the my presentation, I made mention of statistical tools and machine learning tools, and even deep learning tools, talking about neural networks. I made mention of some machine learning tools like k-nearest neighbors, statistical tools. Well, I didn't make mention particularly of Python and R, because again, I just summarized all of those tools. Because of the time available, of course, I could not go into the nitty-gritty of the contribution of statistics, machine learning, and deep learning in model building. That's a huge topic on its own. Yes, sir, you are right. Those are very relevant tools that are used also in model building. Maybe again, maybe it's a challenge for us to probably bring machine learning specialists or deep learning specialists or AI specialists, that probably can throw more light into this, how these tools can be used in building our models. Thank you.
Thank you very, very much, Dr. Otimi, for that wonderful response. So it seems people, most of us are getting ready for our programming in biomedical science. I was sharing something like this with somebody yesterday in the office. I told the person that all my children must learn programming. All, irrespective of your field of study. All my children must learn programming. You know why? We are in the world of program. In fact, the Holy Book, the Bible, even tells us that we are God's program. And we are told that everything that happens on the earth, God is aware. That means the earth, the world, the activities has been programmed. Just like an author reading scripts is programming. What that author will do, will say, has been programmed by the scripts. So predictive modeling, the peak of it is in programming, where we use R Studio. We use the Jupyter, we use Python for programming. I have Anaconda. I use Anaconda, and my own Anaconda has up to 250 programming languages in Anaconda. That's up to 250 programming languages. So the peak of modeling is in programming. Not only modeling, all area of science, the peak is programming. Eventually everything we use around us are programmed, and most of us have left that for only those who are in the computer sciences. No. So I will encourage us here to go and start learning programming. If you can start with the basics, the QBasic, that is if a QBasic still exists. Start with QBasic. That was what we learned those days. Start with the QBasic, HTML, C++, JavaScript. Then before you look at some specialized softwares, please, Python is common. In data analysis, look at SQL, Tableau, Power BI. So all of these involve little programming, involve a programming. So for you to build an effective model, you still need to include programming. Even that machine learning is a program. Yes, you write a program that will instruct the model on what to do. You design your model yourself. So we cannot do without programming when it comes to effective predictive modeling. I really appreciate Dr. Daniel for that insightful question. Thank you so much, sir. Yeah, Sunny Dati. Doc, please.
I don't know if I can ask a question.
Right. Yes, sir. Yeah, go ahead, sir.
Okay. I just want to thank Dr. Rotimi for the presentation and for the contribution of everyone. I just want to reiterate, if you look at his teaching, he has moved from pharmacology to pharmacognosy to statistics to AI, deep learning, and to be very realistic, it's going to be very difficult for one person to acquire all this knowledge at the expatriate level, which we want to fly out. So this call for deep collaboration. Hello?
Hello, sir.
Yes.
It means that we must begin to collaborate.
Hello, sir.
Network with one another.
Mr. Dr. Sani,
Yes, sir.
You can just hold on. Let Patrick finish.
Okay, sir. Okay, sir.
Yeah, he's already on the mic.
Okay, thank you.
Yeah,
what I'm
ahead.
saying is there's a need. I think you mentioned something similar to that earlier on. You cannot be an expert in almost every aspect because it's multidisciplinary. There's a need, we must form a research team whereby we all bring in the little from our various fields and then use it to build what we actually want to do. The aim, like we have said, is developing a product. So they are experts in different aspects, different areas. So the need for having a research team is very, very important. I think that's the way forward. I must thank Dr. Rotimi once again for his inputs and his vast knowledge. He's not only a pharmacologist, he has moved to computer. Thank you. God bless you.
Oh, this is always what is in my mind. Research teams. Okay. Dr. Vincent and Dr. Otimi,
Hello?
I would like us to respond to this proposal
yes,
now.
The proposal is germane, it's fantastic. So you are the lead convener, and so we can actually, maybe after this, we can also put up this research team together, different aspects of it, so that we can bring our idea from various fields of endeavor, and then we can really focus and create a robust research team, and then begin to drive it, both nationally, internationally, a research team that can actually come up with really serious proposal that some persons who are in government or even institutions and funding agency can look at proposals like this, and then they are ready to fund it, especially when they know the integrity of people who are in that research team. So, but again, we all cannot do it. So you being the lead convener, you put that together and let us see the paperwork, and then let's contribute and then have a draft of something that we can work with as a research team. I think that'd be very, very wonderful. Arising from this. Professor Patrick, Dr. Harry, if you may know, Professor Patrick actually is my teacher. He's a professor of pharmaceutical chemistry with specialty in medicinal chemistry.
Wow.
From my department, yes. So yes, put that together, we'll work together and see how we can, collaborate, bring everybody on board and see how we can drive this together. Thank you very much.
Thank you for, I know Dr. Daniel is already into this, Dr. Rotimi.
Sure. I am
Dr. Rotimi, you have pushed us into this now. This was not the objective of this webinar. So
well, I think it's a good one. When you gave me this topic, I was somehow reluctant because of the fact that I'm more of a biology person. But again, I saw it as a challenge, and I took it up. And again, as I said, it has also inspired me into learning some of the things I didn't know before. And it's a good one that this is also bringing out this type of inspiration, amongst us. It's you are the leader. I know that putting a team together is not an easy task, but I know that if the will is there, we can achieve it. And I think we have to do it because whether we like it or not, nature will continue to demand from us, and we have to respond to the demands of nature in providing solutions. And I think this is a very, very, very solid platform for us to bring our thoughts together to be able to provide, solutions to complex problems of humanity. So I think, I will encourage. I will also, be very optimistic. I mean, I'll be very, very interested in joining such an effort in putting heads together, to form a group so that we can see how we can move this forward from here.
Okay, that is I'm just I personally myself, I'm just speechless because this will be innovative, and I think it's timely. It's really timely, considering what a lot of things we are facing, and the downwards integration in science and challenges we are having around us. There's a lot to do. There's a lot to do. Somebody will say, everything has been done, but there are lots. There are lots to do. So I have, I know some persons we love to be part of this. I know Dr. Bright Oba is here. I know he will be part of this. And thank you, Dr. Vincent, for letting me know more about Professor Patrick. So you are welcome, sir. Yes, Dr. Abiodun, you can go ahead. I can see your hand up.
Yes, sir. Good evening, sir.
Yeah, good
Good evening, Dr. Vincent and Dr. Rotimi. Thank you for the wonderful presentation. In fact, I listened from the beginning to the end. God bless you, sir. And I'm also happy about the formation of a team that was discussed earlier. And another thing that I want to add is the aspect of collaboration for a particular idea to be actualized. For real, there is in bioimaging specifically, and still there will surely be need for a collaboration. And this kind of a program will give us a kind of room for collaboration, whereby anywhere we're having a kind of challenge, we can easily communicate one another and provide solution to it. I'm very sure each and every one of us, we are running one program or the other, especially we that happen to be a upcoming researcher, and I pray we get there by God's grace. So I want to use this medium to appreciate the effort being put in place by Dr. Henry. In fact, God will continue to bless you even more than your expectations in life. Thank you very much, sir. I'm so grateful.
Thank you so much, Dr. Abiodun. Yeah, thank you. Before I call up Dr. Adiola, Dr. Sani Dati, I don't know if you...
Hello, sir.
Yeah, yes, sir. Sorry, sir.
Sir, good evening, sir.
Yeah, good evening.
I'm very happy to join this program. despite now I'm not much about I'm not in much about chemistry, but my background is chemistry, sir. Now I'm fully in soil science, but soil chemistry offshore. Hello, are you hearing me, sir?
Yeah, clearly.
Yes. So I'm very happy to attend this lecture from the first minute to the end, or to this time around. I'm commending the speaker, Dr. Rotimi. He has done justice to the topic. But my question is, sir, how can me as a soil scientist now, soil chemistry option, can I use such modeling in solving some of our problems in soil chemistry? I don't know, sir. You know, you are superior over me. We are just coming up as a researcher now. So, sir, that is my own question. Thank you very much.
Okay, before I call up Otimi to attend to that, Dr. Dati,
yes, sir.
I love being realistic. So, give me two major problems you want to solve. Then we're going to tell you how you can apply predictive modeling in solving those problems.
Yeah, like now I'm even about to enter one research, sorption and desorption of carbofuran in the soil.
Okay.
Sorption and desorption of carbofuran in the soil. So I'm just trying to locate like 3 or more places to examine such.
All right. Now,
yes,
you want to detect the presence of a carbonfluorans in the soil, and
yes.
Now after detection, you look at their adverse effects on the soil, probably
yes.
on the soil health, especially on the soil health, soil fertility, and others. Now you can definitely apply predictive modeling. Now, all what you need to do is that you have to source for data on carbonfluorans. Probably, I don't think. Well, you just have to source for data, look out for information that regards carbonfluorans in the soil.
Okay.
In building model, you must have your response. You have your input data, and you have a response. So the response is effects, the adverse effects of this carbonfluorans. So that means you're going to look for data that has information on carbonfluorans detected in the soil, their concentration, their level. You have to look out for data. So keep looking for data, soil data that have been analyzed, that carbonfluorans has been detected. Now you look at different regions. And their diversity. You can build this data yourself, but that will be expensive for you because you have to start doing experimental studies on different variations, different seasons, different locality diversity, different geography. So you keep collecting these data and you study them. Then you now build a model with those data. Now, what that model will do is that if you are working on seasonal variation now, you can look at that parameter, seasonal variation. So you can now say, based on this model, you can predict the level of carbonfluorans during rainy season or during dry season, or you can now use those models you have detected those data you have collected to now build a model that will tell you that if the level of carbonfluorans get to this this concentration, then this will be the adverse effect. And of course, most times we don't build a model that will give us a solution. Most times we just build a model that will give us response, outcome, what will happen if this gets to this extent, what will happen. So use experimental data. Number one, use experimental data from
Hello, sir.
different, yeah.
Thank you
So
very much, sir.
yeah, okay, thank you.
Yes,
So
sir. Thank you.
if there is more response to that question, then I can welcome other ideas and suggestions to help him out.
Okay, sir. But sir, this lecture now, or this
Yes.
presentation, how can we get the material so that somebody can go through? Because he discussed thoroughly on this algorithm. I want to go over it again. I don't know whether you will send the soft copy to us.
Okay. I hope you are in the webinar series platform, right?
So I'm just in this Apri Science. That is where I saw it, and I didn't. I don't know whether you have any other group.
Okay. Yes. Also a member of Africa Science. I'm going to drop my contact now, so you can reach out to me with that
Okay.
contact.
Okay.
But did you register for the webinar?
Yes, I registered since about 2-3 days ago.
All right. So if you registered during the registration, there was a platform that you would have also clicked. You would have clicked.
Okay.
After registration, there was a link that showed up, enabling you to join the WhatsApp platform. But
yes, I joined one, but I didn't go over it. It's today that I saw the email, the response email that you have done during my registration, and I joined the platform, but I didn't open it. It's only one platform. Here, something I can't call the name now, but when I go to my phone now, I can detect the something.
All right, thank you. So I've dropped my number on the chat box, so you can just give me a DM. Give me a DM. Because the recordings, we usually have a culture here that in all training we give you textbooks, materials that you can study on predictive modeling, about 5, alongside with the slide, with the slide for the speaker, and then the recording of this session will also be included. So you usually we send that link to our webinar series platform. Thank you once again.
Thank you very much, sir. Thank you. I'm very grateful, sir.
You're welcome. All right, Professor Adiola.
Yeah, thanks. I would just like to say that I'm also open to the collaboration, the issue of the collaboration. I'll be very much interested. I'm an animal and environmental physiologist, and it will be an honor to work with other experts on this page. That's just what I'd like to add, that I'm also interested in the collaboration like we are discussing. Thank you.
We really appreciate all our interest. But definitely it will be a very tough one. Yes. But
I'm also interested, sir.
Really tough. So, all right.
I do.
Yeah, Dr. Ilese. So we really want to thank Dr. Otimi. Okay, sir. Noted. We really want to appreciate Dr. Otimi Olabi for it.
Hello?
Yes. Okay.
Yeah, I just want to first I want to commend the presenter, and I want to commend you too. In fact, I like the presentation, although I face glitches due to rain here. So, and I want to Dr. Henry. So please, we need presenters like this in the nearest future, because with the little I was able to listen to, I could see that it was precise and concise, no story, and audible enough. So we want to encourage you to do more, and then we'll be expecting the video, and then the PowerPoint. So that's my own contribution.
Thank you. Thank you. Yes, we promise you that the March webinar will also be power packed. We have taken our time to plan for the year 2024, and we are not going to rest. 2026, we are not going to rest until we achieve our target. Yes, we are not going to. Bible said, a little sleep, a little slumber, and poverty will come after you like an arm robber. So we are not going to take that sleep mood. So we really appreciate Dr. Rotimi. On behalf of Hendeb Industries Nigeria Limited, we are grateful. And we believe that one day we shall meet ourselves, and that day will come. So we raised an issue here, which I'm still thinking, I'm still reasoning about it, but I don't have option at this point due to the calibers of people who have declared interest. I don't have the option now to turn it down. So the only option I have is to okay it. And then Dr. Vincent have said that I'm the lead, because I will not be the lead at this time. So I'm going to push the ball to one of us to anchor, and reason because I know we have a lot. Plus, the problem we have now is our commitment. This will be another commitment too. This will be another commitment to what we have already. So I will speak with Professor I.E. Otokore. Then I will drop message to us, to those who are interested, but I will not oversee this team. I think I will push it to one of us here to oversee the team. Yeah. So I appreciate all our contributions and efforts. Yes, this is really, I never planned for this, but it has come. We'll take it up. We'll take it up. Thank you once again. So let's now begin to think how we can apply predictive modeling in our research. I have a lot to share with us, but this thing just weakened my, just weakened me now, and I'm just thinking how we can start and get it achieved. So I wanted to share a lot on predictive modeling, real life scenarios. There was a work that was done. There's a work that was done in South Africa. They had issues in identifying a plant species. Okay. I was privileged to meet those guys at UNN. They had issues of identifying some plant species. So they built a model. They built a model. So once you input the genetic data of that plant, the amino acid sequence, genetic, the whole genomes of that plant, once you input it, it will just identify it, tell you everything about that plant, no confusion, because a model has been built. Their issue was they wanted to have a documentary of the medicinal plants in South Africa. So they noticed that some plants are not known yet. So they built a model that can, even by, like we used it in our phone now. There's this app, once you snap the leaf now, it will give you the name of of that leave to some certain percentage. All these things are working by modeling, by prediction. Yeah, by modeling, by prediction. So we'll see that extent where we can have adequate models that we can use. It will limit our lab work. It means that at that time there will be no lab work, like no much lab work, because we have been doing lab work for how many years? How many years we have been doing lab work? We trained our students on lab work. We are trained with lab work. Now modeling is the future. So thank you very much once again, Dr. Rotimi. Appreciate you for your wealth of knowledge. I have learned a lot. While you were teaching, I was taking my pen, my book, I was just writing. I was just taking notes. So at this point, I want to say thank you to everyone who were able to state this moment. I think I will just take my time to appreciate one after the other, because it is not easy. It's not easy. I have still here Dr. Abiodun, Abisoye, Dolphin, Adiola, appreciate Aina, Oluwatoyin, Andu, Onojo, Apata, we appreciate you, Shiu Ali, Bube Oyi, Dr. Choma Wofo, we appreciate you, Daniel, even Dr. Bright Chidima, this Obidima, sorry, Oba, Dr. Vincent, Glory Mary, Dr. Idris, Dr. Pomo Lafayette, so sorry, Dr. John Elijah, appreciate Taimuyu, sorry if I'm destroying your name, really see. So I want to appreciate every one of us, Olawoye, Mary, I want to appreciate Oluwabenga John, so many of us, Professor Patrick, who are still here with us till this time, Pulimi Adewale, Dr. Rotimi Olabi, Sani Dati, and others who are still till now. I want to say thank you for coming around. Without you, then this webinar wouldn't have been here. So thank God we had this webinar. If not, we wouldn't have had this vision. So thank you once again. I will allow us to have a night rest. So once again, thank you, and God bless you all.
Dr. Henry, you keep calling me professor. I corrected you, but maybe you are praying for me, Sha. I receive it in Jesus' name.
It's a prayer now. It's a prayer. Wait, don't you know that outside being a personal chemist, I'm a priest too. I have
okay. So you are praying for me, I receive it.
I have oil on my head. And the oil I have is not granite oil or palm oil.
Thank you so much.
Thank you so much. Good night. So we'll meet next week, Wednesday and Thursday, on the QSAR and the QSPR. The flyer will be out by tomorrow or tonight. And we have a training ongoing. You can key into that training. That is a green chemistry. We did an introductory part on Tuesday. It's 1 month training that started yesterday. It run till the end of February. It's an interesting training just for 20,000. You can key in and it will be very wonderful. We have a training coming up by March. Yeah, on macro modeling, molecular modeling, and molecular docking. That is also another wonderful training. The flyer will be out tonight or tomorrow morning. These are trainings on the pipeline. We are proposing to have a beginner's course on data analysis towards the end of February, the last week of this month, a beginner's course on data analysis. So all flyers will be available tomorrow. Thank you for those of us who have been sharing our adverts, sharing our flyers. Once we place flyer and it goes viral, those who share our posts on LinkedIn and other platform, we really appreciate you. Together we shall get to our destination and where we want to be. Once again, good night and God bless you all.
Amen. Thank you so much.
Good night, everybody. Thank you.
Good night, all.